Social Security, Medicare, Medicaid, all the benefits they're entitled to because the bureaucracy is just way, way too difficult. I ran the third busiest Social Security office in the country. Before that, I worked for the Department of Social Services, and many moons ago, when I had actually less hair, I was a sergeant in the Marine Corps. So I've spent most of my adult life in the bureaucracy. So I'm going to tell you, show you, explain how to go about it and make sure you get everything you're entitled to. The whole bureaucracy is very difficult to navigate, but I'm going to help you do that so you can get your retirement, disability, survivor benefits, Social Security card, Medicare, Medicaid, and the whole process will be relatively painless. Let's put it that way. All right. So this is good. This is a live broadcast. If you're watching this later on, make sure you share, because after I talk about how to deal with your local Social Security office, I'm going to open it up to anybody that has any questions, and I'll do that for about 45 minutes or so. So if you have any questions on disability survivors, spouse benefits, make sure you're getting all the benefits you're entitled to. And so we'll do that for about 45 minutes. Okay, so let's go ahead and get started here. How do you get to the local Social Security office in terms of appointments? What type of issue you have? Most of the offices, so there's over 1,500 Social Security offices, field stations, the administrative law judge, DDS is the Disability Decision Servicers. Those are kind of state agencies. But we're talking about your local district office, field office that is in your local area. It says Social Security Administration. You go down and file for retirement, get a Social Security card. So those are the offices I'm talking about. For the most part, and the Social Security Administration gives each office, each area, a little bit of latitude, so they all do things a tad bit different. Like I said, I ran the third busiest Social Security in the office in the country, and that was kind of good because we had different clientele, and I was always out there trying crazy things to improve customer service, which a lot of offices have since copied. So, but we're still terrible in terms of customer service out there. Still got a long ways to go. But in terms of appointments, people always say, I'm going to go ahead and schedule an appointment. For the most part, 99% of the time, you can only schedule an appointment if you are filing a new claim. So if you're filing a new claim for retirement, disability, survivor benefits, spouse benefits, anything like that, a brand new claim, SSI, then you can schedule an appointment. Other than that, you have to go down to the local office, do your transaction online at ssa.gov, or call the 800 number. So these are called inside the ballpark, they call them PE, post entitlement issues. So if you're already receiving Social Security, retirement, disability, whatever the case may be, and you need to go get a 1099 or change your address, you can't set up an appointment for that. If you want to go down there and get an estimate of what your benefits will be in the future, you can't set up an appointment for that unless you actually are, you can't set up a retirement appointment at 58. But you can at 62 and go down there and get your numbers and not necessarily file at that time. So you have to set up an appointment and they give you your numbers. And at that time you say, okay, pull the trigger, start my money. Or you say, no, I'm going to wait a year. So that's one kind of inside trick of how to get your definitive numbers without, actually pulling the trigger and starting your benefits. So for the most part, you're going to have to go down there. And a lot of people, contact me during the Q&A and say, hey, my local office, I really don't like it. I like to go to another office in my same town. They're a lot nicer. It's, it's actually closer, whatever, the parking is better, whatever the case may be. But when they go there, they say, this is not your office. Your office is on the other side of town. Every office in the country is your office. So don't let them tell you different. One of the reasons my office was the third busiest in the country, we had two other offices, but I would argue our customer service was a lot better. So everybody came to our office, which made our office the third busiest. And, yes, we would tell them, by the way, there is an office closer to you. And if you say, yeah, I know, I just like to come in here, and you say, oh, okay, all right, fine. It's on my way back from work or whatever the case may be, then, yep, they can't make you go to another office. if you have a pending claim and it's in a particular office, and you just, you just don't want to go to that particular office, you just want to change it to another office, then it's a little bit more difficult. They're going to have to transfer that claim to another office, the pending claim, but it is possible. It is possible. So you just go there. No, those people treated me terrible. I don't want to deal with those people ever again. I want to go to another office on the other side of town, and they have to transfer your case to that particular office. So they can't deny that. All right. In terms of documentation, anytime you go down the Social Security Administration, you have to provide original documentation. So if it's in the marriage, has to be the actual certificate, not the license, but, 'cause when you get a license, that means you can get married. Doesn't mean you actually went through the marriage, right? So you have to have the actual certificate that you actually got married. If it's a divorce decree, it has to have the one with the little raised seal on it. If it's a birth certificate, it has to be the original birth certificate from, not the original birth certificate, you got in 1964, but the original birth certificate, meaning the one from the issuing agency. So if you were born in Paris, Texas, it has to come from Lamar County, Paris, Texas, birth certificate, vital statistics. So it has to be the original. And again, it has to be the original with the seal and all that kind of good stuff. Social Security does not accept copies for the most part. W-2s, you can get copies of those, but pretty much everything else, you have to have the original. And you give it to them, they make a copy of it, and then they return your original to you. So you don't waste your money on a notary public. It means nothing to Social Security. Social Security has to make the copy, and then they'll hand the original back to you. And don't translate it. Don't wait. If it's in a foreign language, don't waste money on translations. Social Security employees have to translate it. So I used to do pretty much the Japanese translations for the entire West Coast. As I speak Japanese. So there's people throughout the country that work at Social Security, or they have an organization that helps them do translations. So don't translate it. Social Security has to translate it themselves. All right. So the lay of the land for the office in terms of staffing. So here's one of the big reasons a lot of people are missing money is they walk in because they don't have an appointment, and they walk into a Social Security office, or they call the 800 number and they say, yeah, I want to file for X, Y, or Z. So for instance, we've found, hundreds of thousands of dollars of lifetime benefits over the last week or 10 days for people independently entitled divorced spouse. So those are divorced spouses that were married to someone for 10 years, but the ex-spouse hasn't filed for benefits yet, but that person is 62 years old. So whether they file for benefits, it doesn't matter. If you are at least 62, you file for benefits on your own record. If your ex-spouse or your current spouse is benefit amount is twice as much as yours, you can file regardless if they filed or not. So we've had a few people go into the local office and sit down, they pull a number or whatever, they go to the window, and the first people you talk to are called CSRs, customer service representatives. They are the hardest working, least appreciated, lowest paid people in Social Security. But they're masters of all, not experts. And now there's a 27-year low staffing in Social Security. So they're putting unfortunately, a lot of people at the window don't know, aren't fully trained yet. It takes a couple of years to really start knowing your stuff at Social Security. And unfortunately, people are being turned away and say, no, your ex has to be filing for benefits. And there's probably thousands of people across the country that are losing benefits because they're told that incorrect information. So that's why you should subscribe and come here. And, so we've actually had to provide the actual reference number in the policy, which is 20,000 pages. We provide the reference number, and the people go down there and they're told, yeah, I want to file for my ex-spouse's benefits. And they look and say, oh, no, he hasn't filed yet. You can't file. Then the person pulls out the reference number, and then that employee disappears in the back for about 10 minutes and comes back and says, oh, okay, I guess you're right. Let's get you some money. So be careful of kind of what you hear in the front windows. Definitely be careful what you hear on social media. Oh my gosh. I spend most of my time correcting social media, BS and lies and clickbait. All right. So once you get past that first phalanx of people, the CSR, And if you're actually going to be taking a claim, there's two sections. There's Title II CSs and Title 16 CSs. Title II are retirement, disability, SSDI, survivor benefits, spouse benefits. Title II of the Social Security Act. Title 16 section is SSI, Supplemental Security Income, the welfare-based program. And the CS is a claim specialist. So if you're actually going to be taking an SSI claim, you go back and you talk to the Title 16 claim specialist. If you're taking a retirement disability survivors, you're going to be talking to a Title II CS. And each of those units has a technical expert. So if you disagree with the claim specialist of, their calculations or what they're telling you, say, hey, could you check with your TE, your technical expert? And they're supposed to be, the number ones in the office that really know the details. And then there's the assistant district manager and the district manager. I was the district manager of my office. So those are places you can appeal to. And so that's kind of the layout of staffing and what you need to deal with. And then if you get an incorrect decision, you ask for someone else. But if you still just don't agree with the decision, you have appeal rights. Anything with the government, you have the right to an appeal. But it has to be an official decision. So if somebody just tells you, something at the window and you don't believe it, you'll say, well, I kind of need that in writing. An official decision. So once you get that official decision that you're denied or, you benefit amount, but you don't agree with the amount, then you can file an appeal. And the first step is a request for reconsideration. You can do that by an SSA 561. Very, very easy to fill out. Just a few lines. You say, hey, I disagree. I think I should be able to get benefits even if my ex is, not 60, not filing for benefits or whatever the case may be. So you file the request for a reconsideration. So someone else completely different in the office, checks it out and reconsiders that decision, and you'll get another decision letter. And if you disagree with that, then you can go to the administrative law judge and get your day in court to kind of, Social Security court. But unfortunately, that takes forever and ever and ever because they're completely backed up. So there's that. What if you get bad customer service? Then please complain. Write a letter or say, hey, can I speak to your OS, your operations supervisor? Can I speak to the ADM or DM or whatever the case may be? And speaking as an old district manager, please complain, because my office, we had 100 people, 99% of them were awesome. But there was always one or two every now and then that came in, transferred in, or, we hired the wrong person or whatever, and they were just terrible. But in order to fire somebody, usually at the first year, it's easy to fire people. But after that, it's more difficult. So you have to get kind of a pattern, because, people are people. So if you complain, that might be the third strike. So I've had cases where, just sitting around every day, did we get a complaint on this person? Did we get a complaint on this person? And then one day we get another complaint on that person. We're like, yes, got it. Now we can get this person out of here and get someone in here that actually likes helping people and, providing good customer service. So please complain. It will help everybody else out. All right. So I didn't do too bad there, 13 minutes. So now we can get into your questions. Anything about getting into your local office, any other questions I didn't talk about, make sure you jump them in there. All right, let's see. We got Carol. I spoke to a person in the Scranton office this afternoon. She could learn some good customer service skills. I call in for an appointment for IEDS to begin in November. Can the divorce decree be the front page with the names and even Social Security numbers, and last page with judge's signature? Yeah, that's pretty much all they need. I'm not sure. Yeah, I'd have to look at the document, but yeah, I mean, I would provide the whole thing, and that way you don't have to go down there again for something. But that's the only thing they actually look at. Yes, is again, they don't look at anything else about. Again, there's thousands of people out there that are missing money because in the divorce decree it says you can't get my Social Security, which Social Security doesn't care about. So all the divorce decree has to say is the two names, when the divorce was, and yeah, it has to be the raised seal. And if you wanted to change your name back, that's the only other time they would look at anything else in the document where it's like, I want to restore to my previous maiden name or something like that, then you can update your social security card. But at least, do they, the person at the front window, did they recognize there is such an animal as independently entitled divorce spouse? Or hopefully I've embarrassed Social Security enough, because we've done this so many times, and hopefully the word has gotten out, and Social Security has done some training on that. All right. I call over and over again, and they never answer and hang up when I get close. Would it help if I mail a letter from my congressman? Yeah, the new commissioner of Social Security, he's got this new security stat thing, and he's supposed to be helping. It's supposed to be reducing the call. That's the big thing on call, answer rate. But as I always mention on this, the offices, the whole Social Security is kind of a whack-a-mole situation, where if they improve, answer rate of phones, then the lines in the actual offices will double. If then they move all the resources to, helping people who actually walk into the office, then the phones suffer. And then if they focus on these two, then, it takes forever to get your claim adjudicated. So those three things, it's like whack this one and this one jumps up, whacks this one. So it's anyway. Yes, not necessarily a letter from your congressman. How it works is you go onto your congressional website, senator, House of Representatives, the federal person, the person that goes to Washington, D.C., not the person that goes to your state capital, but the person that goes to D.C. All of them have a little button on their website that says, I need help with a federal agency. You click the little button, you sign the little, release thing, you tell them your story, you push it, and it goes to the congressperson's office staff, and they don't read it. They don't understand most of the stuff. They just say Social Security, and then they send it to Baltimore, which is the headquarters. The Baltimore sends it to the regional office. The regional office sends it to the area office, and the area office sends it to your district office. And those, that's how to light a fire in the Social Security Administration. Because when my office got that, we had to. Everybody is supposed to respond within 24 to 8 hours. 24 to 48 hours. So that's a good way to light a fire. Now I need and want to work on being my own payee. It's not comforting with keeping up with my daughter's mother. Yeah, so the representative payee, I did a video on that a little while ago, last week. If Social Security cannot refuse you to be your own payee, they can highly recommend, but they can't hold back benefits if nobody else is willing to be your payee, or you say you want to be your own payee. To make it a lot easier, the best way to do it is to go to your doctor, and whatever the issue is, physical, mental issue, whatever the case may be, and say, tell the doctor, says, hey, can you write me a letter that says I can take care of my own benefits? And then they'll write you a letter. Yeah, he or she should be able to take care of his own benefits. And you take that down, and they will make you your own payee. But don't do like we used to get every now and then a letter from a podiatrist for people with mental issues. It's like, I'm not sure how a podiatrist would know that. So, Dr. Ed, how do you get a job with Social Security? Yeah, opm.gov, usajobs.opm.gov, usajobs.opm.gov. Or here's how I recommend, because offices get allocations for hiring all the time, out of the blue. So if they've got kind of, resumes sitting on their desk, those have, a little bit of priority. Not really supposed to be holding the resumes, but everybody always does. If you're a vet with certain medals in particular times, you've got kind of priority. So, but I love working for Social Security. It was awesome. The people are awesome. We were never able to do the customer service I would like, but the job, helping people out in their dire times, or their great times when they finally retire, was an awesome. I loved every minute of it. But take your resume, and don't take the short version. Take the long version. I mean, because you don't have to have any experience. Once you're hired, they send you to class for 3 months, and then you're on complete review for about a year. So they teach you everything. The big thing is actually customer service, that you actually have experience with customer service. So put all those details down. I mean, put it down to the level that you're like, wow, this is stupid. This is too much detail. As soon as you start thinking this is the stupidest thing, this is way too much detail, you're on the right track. So a lot more detail, because what they do is they take a resume. Once they send it up to HR, they've got this algorithm. They put it through the system, and the system picks out, whether this person has the customer service background that is needed. So yes, the long resume with dates of how long you did it and how many hours a week you did it. I mean, just crazy amount of detail. I love this channel. I'll be 62 in November and will be collecting Social Security on myself and an ex-spouse. What will be my earning limit if I continue to work? Yeah. This year it's $22,320. But starting November, you're going to be the monthly test. So in November, as long as you stay under $1,860 for November, December, and then next year you have to stay under the annual, whatever the annual will be for next year. It's probably going to be what, 24,000 or so. Thank you. You're welcome. Had my phone appointment today. Nothing in ex-spouse benefits extra for me. But at least I know for sure the PA amount. Okay. Let's see. Follow up. PA in my local office told me it was wrong and way off. Same with the amount of given via the same online was wrong. Yeah, you don't get definitive numbers until you actually file a claim. The online estimator is just that, an estimator. And when you call up, it's, estimate's not too terribly off for the most part, unless you receive a non-covered pension from a state, local, or government agency that doesn't pay into Social Security. But yeah, it's not too terribly off. That's why, I recommend not, paying some company to run your estimate for you, because, they charge you, $100, $200, $300 or something for that. And I've seen millions of those, and most of the time they're not accurate. So just, go online, and once you file the claim, then it's the best. Yeah. And there's another thing that there's, probably tens of millions, hundreds of millions of dollars being lost is spouse benefits. So determine whether you're able to get benefits off your spouse or your ex-spouse. Your benefit amount has to be less than theirs. But when I say benefit amount, I mean the PIA, which is your benefit amount at your full retirement age. So you have to make sure, you're comparing apples with apples. Your benefit amount at your full retirement age versus the benefit amount at your full retirement age for your spouse. Even if you took your benefits early or after, that's the number they go by. And so people said, hey, I was married to that person for 10 years. I went down there and they said, I'm not entitled. No, you're entitled because you were married to the person for 10 years and you're currently not married and all that kind of good stuff. But you're not entitled because there's no more money there to be paid. So a lot of people, unfortunately, hear that, they heard that 10 years ago, 20 years ago, that they're not entitled to ex-spouse benefits, and they think that's the case forever. But that might not necessarily be so. Maybe your ex started working more and making more money, and now you weren't entitled, 5, 10, 20 years ago, but you might be entitled now to an extra, $50, $100 a month or whatever. And when your ex-spouse passes away, or your current spouse, surviving spouse benefits, you get 100%, not up to 50%, you get up to 100%. So I guarantee you, there's tens of millions of dollars out there being lost because, some, person's in 70s or 80s years old and, struggling to get by, and they checked with Social Security 10 or 20 years ago, and Social Security says, yeah, you're not entitled to benefits on your ex's record. And what they meant is today, because of the benefit amounts. And then that person has gone by 10 or 20 years and could have got surviving benefits, and they're not getting it. So Please subscribe and share and like and all that kind of good stuff, so these videos get out to those people that are struggling, so we can help them get what they're entitled to. Lola, still married in paper, and his social security is twice mine. There is any way to get some money for him? Yeah, if you're still married, and to that person on paper, social security doesn't matter whether you're, living apart or, anything like that. If you're technically married, then you're technically married. So if that his benefit amount is twice as yours, then go down there and get your money. Social Security added missing years of income. We received a letter telling us they were added and we have 60 days to appeal. They did not tell us what the monthly amount will be. We have to wait another 60 days. Yeah, that's the appeal thing on that one. That sounds it's not something probably you want to appeal, because that's good. But yeah, they add appeal language to every single letter. But probably the appeal letter, that letter would say, yeah, we added your earnings, but they really should have said, how much is that going to increase your benefit amount? But that's good. So that means, so it is possible. See, I tell people all the time, check your earnings record. So 21550 Spurs checked their earning record and found something was incorrect, and they got it corrected. Social Security says, oops, yep, you're right, it's incorrect. So they added those earnings back in there, and now they'll recalculate. So if you're already receiving benefits, then you'll receive another letter. The computer will automatically generate another letter. It'll tell you, hey, we're going to give you more money now, because the letter probably won't say why. It'll just say, we recalculated your benefits and here's the extra money. And the great thing is, if you've been receiving benefits for 5 years and you corrected your earnings record, 10 years ago, earnings for 10 years ago, that means your benefit amount for the last 5 years has been incorrect. So the computer will automatically recalculate and say, yeah, we've been paying you wrong for the last 5 years. Here's a big check. So yeah, that's a beautiful thing. And that's the thing. If you believe the calculations are wrong, then you appeal it. But yeah, so that's a beautiful thing. I like it. Hi, Doc. Does it matter if it is misspelled on Social Security card? Part of my divorce settlement was being able to change my legal name back to my maiden name. Not sure where error occurred. Yes, 100%. You definitely need to get that fixed, because when you go to do your taxes, it'll be a computer system mismatch. And yeah, they might reject your taxes if they haven't. Sometimes the computer systems are a little bit more OCD, and sometimes they let it slide. But one day the computer system will be OCD and your taxes will be kicked back. So yeah, definitely go down there and get that fixed. And whether it was so yeah, not sure whether it was the divorce settlement or when the person put it in the computer. So yeah, and as I did a video yesterday on the Social Security card. So make sure the spelling is correct and everything. And then when you go down there and says, hey, what date of birth do you have for me? Because on your Social Security card, internally and internally, they have the date of birth on there and what city and state you were born in, and your parents' name, and your mother's maiden name, and I have all of the information. So kind of, correct your name and, say, hey, by the way, what date of birth do you have for me? And that way, when you actually go file for retirement later, you can get it fixed. Yeah, and it will be an issue once you go eventually file. So I need to do 3 applications to collect spousal support. Do I do that online or over the phone or in person? All right, so 3 applications. So that's if you and your husband, Rose, you and your husband are going to file at the same time. So what happens is, the higher earning spouse, you or your husband, whoever, files, starts their benefits, and then hands the phone over to you, and you file for benefits on your own record, and then you file a spouse benefit on your spouse. So yeah, it's 3 claims. But if you're already receiving your own benefits and that person is already receiving their benefits, then it's just one spouse claim. Grateful Girl, I am divorced more than 10 years. I received Social Security disability, just told by Social Security that my benefit is $1, more than half of what he receives. So unless he passes, I can't get part of him. Yep, that's correct. But Yeah, that his benefit is $1 more. But that's right now. But if he works and you don't, and your benefit doesn't increase, but his benefit increases, and maybe next year it's $2 or $3. So you can, if you want, go down there and file a spouse benefit for the extra dollar. And you're saying, why would I waste my time to do that? Well, then you're on the record. So you're on his record. He doesn't know, unless you tell him. Um, you're on his record, and then when he passes, you're automatically switched to spouse benefits, living spouse benefits to surviving spouse benefits. And, so that way, if you don't keep in touch with him or something like that, then, you walk into the bank one day and all of a sudden your check is twice as much as it usually is. And you can say, oh, looks like that person passed away. So, how can I get the $1,000 COVID money I did not know I qualified for? Yeah. There's so much clickbait out there about stimulus checks and all that. I wish people would stop it. I stopped working in 2010 to take care of my daughter. Can I apply for disability? I have poor health. Um, yeah, there is for disability. There's two insurance statuses that have to be met. You have to have paid into disability for 10 years, 40 quarters, just like retirement. But you also have to be currently insured. That means you had to work 5 out of the last 10 years. So if you haven't worked since 2010, then yeah, it's unless your disability has went back 5 or 6 or 7 years. So I'm not exactly sure about those dates there. But yeah, you had to have worked 5 out of the last 10 years, and not 5 of the last or anything, but out of the last 10 years. So you could have worked, 10 years ago for a year and then stopped for a year or two and then worked another year, as long as there was 5 total years in that 10-year period. How often do they do a reassessment? Um, Not sure what kind of reassessment we're talking about. If we're talking about SSI, supplemental security income, they do that on a regular basis, yearly or every 6 months. For SSDI, your CDR, it depends on what they decide when they adjudicate your claim initially. We won't have to file taxes ever again. IRS is going down. Okay, well, that's good to hear. Husband died at 63, not on Social Security. I'm 61 on disability. What percent will I get in survivor benefits? Um, yeah, probably around what 70. Well, not 71.5. That's at 60. But yeah, I would definitely. He died at 63. So if he's already receiving benefits, it gets kind of complicated with the survivor benefits. So what I would do is I would schedule an appointment to go ahead and take survivor benefits. You can. Here's another. This is probably hundreds of millions of dollars in lifetime benefits that are being lost out there. People on disability think they can't get survivor benefits or can't get spouse benefits. Yes, you can get disability and spouse benefits and surviving spouse benefits, and your Medicare will still continue, because after all, you're on disability, so you're going to get your disability check, and it's however much. But if you're also eligible for surviving spouse benefits, they add that check on top of there. If you're getting disability and you're entitled to spouse benefits, they add that check on top of there, but you're still getting disability. So you're still eligible for Medicare. So you won't lose your Medicare. So at least, who is it? C. Pretzel knows that even though she's getting disability, she can get survivor benefits. So she just wants to know how much. But it really depends on whether he was receiving benefits. He filed early because there's a thing called a widow's limb and rib limb or whatever. But here's what I recommend. Call Social Security, set up an appointment, and say, hey, I want to file for surviving spouse benefits. And if someone on the phone says you can't do it because you're on disability, say, yeah, whatever. Thank you for your opinion. And then talk to a specialist, a Title II CS, a Title II claim specialist, and they will take a claim for surviving spouse benefits, and they will determine how much your benefit will be starting this month, or whenever last month, if your husband passed away last month. And then say, okay, what if I wait a year? What if I start these benefits? Because every month you delay, your benefits are increased. Say, what if I start it this time next year? How much will it be? And they'll tell you, and then you can make an informed decision whether you want to file it early and get a reduction, or whether there will be a reduction, or whatever the case may be. And because you don't have to file. Here's what I always say: Social Security employees are not, used car salesmen. Sorry, used car salesmen, but or any salesman. I'll think about it. All salesmen hate that, but Social Security employees love that. And it's like, okay, well, I'll think about it. And they're like, oh, okay, well, but that, I don't have to adjudicate your claim. I don't have to take your claim back to my office and work on it. You're just not going to do it. That's fine. Perfect. That means I've got an extra 5 minutes. So I can go breathe or work on the other 400 cases I have. So yeah, no, don't worry about, wasting their time. That's their job. And if you decide, oh, okay, I'll call you back next year, then they'll say, okay, bye. See ya. It's that easy. Okay, the follow up on that, he was not getting benefits. Okay, then yeah, so you're probably going to get at 60, you get 71.5. So yeah, you're probably going to get what, 73, 4 or something like that. So yep, that's a beautiful thing. Let's see. Kind of make sure I don't skip anybody here. I've been trying to find out if there's anything I'm entitled to on my previous spouse benefits. Social Security is telling me I need his death certificate, also telling me I'm not entitled. Yeah, that makes no sense whatsoever. You just talk to someone that doesn't know. Yeah, is not very good. So yeah, if you're entitled to benefits. So here's the trick on that. You're like, well, is my ex's benefit amount twice mine? How can I find out? It's my ex. Social Security doesn't like to give out personal information like that, but there's a trick to do that, which is exactly what sounds like what Peggy did. You call up the 800 number and say, hey, I want to file a spouse claim. And for a living spouse, when that person is still alive, you have to be receiving benefits on your own record first. Okay. For surviving, that's not the case. But if that person is still out there alive and kicking, first you have to file for benefits on your own record. Okay. And then you call up the 800 number or your local office and say, hey, I want to file for spouse benefits. And they will look at your record, your PIA. They will look at that person's record, their PIA. So if you don't know the Social Security number, no problem. Just give them the name, date of birth, and they'll find it. And then they'll look at the PIA on that number. And if there's no more money there, they'll say, yeah, I'm sorry, we can't set you. Here's how they're supposed to do it. And I'm sorry, we can't set you up with an appointment, which means there's no money, there's not a claim there for you. So they shouldn't say the best thing. Oh, you're going to need the death certificate for us. And it's like, wait a second, there's no money. Why do I need a death certificate? So maybe they said, okay, you're going to need the death certificate. Yeah, I don't know. I'm not sure why they would say both. You're not entitled and we need the death certificate. What if I'm not entitled? Why do I need the death certificate? So yeah, that makes no sense whatsoever. So I'd call up again and hopefully talk to someone that knows their job a little bit better. So yeah, so long story short, they shouldn't say twice, both of those. It's either one or the other. Can someone get ex-spouse benefits having only 35 as credits at 67? No, unfortunately. Okay, wait a second. Who has 35? If you only have 35 credits, doesn't matter. If your ex-spouse only has 35 credits, then there's no money there. That person is not insured. But if you're not insured, if you only have 35, no problem. But if your ex is insured, then you can file for benefits on that record. You don't have to file for benefits on your own record because you're not insured. No problem whatsoever. Yeah. So yeah, there's probably another thing that a lot of people out there says, well, I'm not insured for Social Security. You don't have to be insured. Only your spouse or so. So Jacob, yeah, let me know whether it's you don't have 35 or your ex doesn't have 35. That makes a difference. It is my middle name misspelled. Yeah, so I would get that corrected. Yep, I would get that corrected. Yeah, that's probably why the IRS hasn't kicked it back as its middle name. Yeah, but yeah, when you eventually go file for retirement and all that kind of stuff, they're going to need that. So you need to get your original birth certificate to show the spelling, if that's where it is. To the death certificate, I was not remarried when he died, but was remarried 6 months later. Okay, yeah, so you can remarry after 60. But or you can remarry before if you're now, so see what I mean? So if you were married to someone for 10 years, 20 years ago, and then after you got divorced from that person and you got remarried after that, and you were remarried to someone for 5 years, but you've now divorced, you're single. So you can get surviving spouse benefits. Oh, and now collecting on second deceased spouse survivor benefits. So now what? Oh, okay, yeah. Then if so, the second deceased spouse benefits. So you're collecting. So that sounds like you're not married right now. So, but if the first deceased spouse is more money, you go back in there and you switch to your first deceased spouse. Yep. So whichever one is the most money. Easy, easy, easy. Done a few 100,000 of those. What types of income count towards the annual earned income? That's the trick right there. Earned income. So pretty much any earned income. People would say, does alimony? I'm sure you would say, heck yeah, I earned that alimony. But yeah, so, but not, that's technically for IRS type. Yeah, it's not earned. You didn't. All right, I'm going to be cautious how I say this. Earned income is actually you go in there, punch the clock, and you know, and work. So that's earned income. So alimony is, yeah, not earned income. Don't get mad at me. I have told and will continue to share your channel with everyone I know. I really learned a lot. Thanks for your time and your service. Very much appreciate it. Yeah, you thank you. I appreciate it. Yeah, we really need to get the information out there. One day Social Security will do the right thing and get out there and tell people, hey, don't forget about this, don't forget about that. But they certainly ain't doing it, are they? So here I am. Bruce 2, 65 years old, 65 and 9 months old, and recently diagnosed with ALS. Let's see whether there's, all right, I'll read into this question a little bit. So probably asking about disability. No, there is, well, it depends. Probably your full retirement age is 66 and something. So, but there's no disability after your full retirement age. Nobody in the country is receiving disability after their full retirement age. Everybody's disability switches to retirement at their full retirement age. So yeah, if you've been diagnosed and you're under your full retirement age, then file. It might give you, won't start your Medicare earlier because your Medicare is probably already started. Um, but yeah, it might give you a little bit extra money. So X has only 35 credits. Yeah, then no, unfortunately. I was laughing because of your response to someone says Social Security is going down. Yeah, yeah, right. No, they actually said the IRS is going down. Yeah, I've heard the Social Security, going down thing. Been saying that since 1935, but that's the first time I heard this. They said the IRS is going down, and yeah, I don't know. But anyway, we all wish that would happen. I've been trying to cancel my subscription to the IRS for decades, but yeah. Can you receive survivor benefits off of a deceased husband you were married to for 8 years? No, unless you were married to the person when that person passed, but you said ex-husband. Oh, you didn't say ex-husband, sorry. But you were, yeah, if you were married to the person when they passed, yes. If it was a divorce situation, no, unfortunately, you had to be married for 10 years. Thank you for the information from Nancy. You're welcome. You're welcome, welcome, welcome. Make sure you subscribe. This is on TikTok. I'm doing the other on TikTok here. In order to get 10,000, in order to do TikTok correctly in my main screen so y'all can see all my stuff, I need 10,000 subscribers. So please subscribe to TikTok and then come on over to YouTube. And so you can see I've got over 500 videos. 500 video is day 73 of my daily live. I'm going to see how long I can get this going. Does SSDI turn into SSI when you turn 65? No. Two things wrong with that. SSDI turns into regular Social Security when you're full retirement age. So the full retirement age is not 65. Your full retirement age is probably what, 67 or 66 and 8 months or whatever. And SSI is a welfare-based program. So you probably mean Social Security. Yeah, your intent was correct. Does SSI turn into regular retirement, regular Social Security when you hit your full retirement age? Yes. Yes. Is there a cap when you earn to receive spouse benefits? Yes, exactly the same. The earnings limit when you collect your benefits early. So whether you're receiving regular retirement on your own record, spouse benefits, surviving spouse benefits, you're limited when you receive those benefits early. To this year, it's the $22,320. Anything over that, they hold back $1 for every $2 you go over. And I just did a little short video on explaining that a little bit more. Just seeing you, what are points? What do you mean by 35 points? Oh, 35, yeah, he was meaning quarters of coverage. So if you work into pay into your FICA taxes for 10 years, then you get 4 quarters of coverage every year. So for a total of 40 quarters of coverage. So this person only had 35 quarters of coverage. That means not insured. So let me, losing my battery here. Let's see. What age can I start collecting spouse death benefits? At 60 years old, you can start collecting surviving spouse benefits. So regular spouse benefits, regular retirement, regular, 62. So Medicare at 65, disability, pretty much any age. Can you get SSA and ERS together? I was told double dipping. ERS. Not sure what ERS is. Let me know what the ERS is. Can I give you my son mobile home land worth? Can I give? Oh, can you give me? Can I give my son my mobile home land worth 10,000 when I pass if he's on disability? It depends on what type of disabilities he's on. If he's on SSI, supplemental security income, the welfare-based benefit, then because that's a welfare base, and all of a sudden he's got a bunch of land. Well, if if even if he's on SSI. If he's on SSDI, then yeah, it doesn't matter, no issues whatsoever. But if he's on SSI and you give him a house and land, SSI and Medicaid, they exempt one home, one car. So if this is a second plot of land or a second home, then yeah, they're going to count it against him. But if this is his first, he's renting and now he has this, then it's no issue. Is it possible that different advantage plans in the state would have different paid allowances for food? 100%. Yes, they're all different and they change every single year. So, and next year is going to be the big one. Yeah, this is, these Medicare Advantage plans have been around for what, 20 years basically. And next year is probably going to be one of the biggest ones because there's a kind of a perfect storm of all kinds of stuff changing. The Part D catastrophic, the government is paying these companies less. They're making these companies do more and provide more, and in terms of notifications. And so yeah, these companies are profit driven animals. So they're gonna look to squeeze out as much profit they can for their shareholders, and what they're hoping is you just stay put, let it ride, and they will slowly degrade the plan you're on. They won't change the obvious stuff. They won't probably start charging you a premium if your current plan is a zero premium. They're probably not going to start charging you $49.95 for it, because then you're going to say, well, 49, let me go look someplace else. They're smart. So they'll probably keep the same zero. And then, they might keep your same doctor. Those networks change every day anyway. But they won't change the super obvious stuff. It's the devil's in the details, they say, right? It's all the little stuff. And then next year you'll be on here and you'll say, oh, I just went to the hospital and they charged me $400 a night for the hospital. When I signed up for this thing, it was only $50 a night. When did you sign up for it? Oh, 2 years ago. Yeah, that was your plan 2 years ago. This is a whole new year. So this year is the time to really, really check in October when the new plans come out. Yeah. And those extra allowances, the food and the over the counter and the utility payments, That's yeah, those are the ones that are probably really going to be hit. They're already talking about cutting back benefits and pulling out of particular areas that they're not profitable. So you really, really, really have to check your plan this year and get with your agent or broker. If you don't have anybody, email me and say, hey Ed, I think I'm good now, but let's talk in October. Let's talk with your team in October and check out what the new plans are and see whether I actually should stay where I'm at or update to a new plan with the same company, because your company that you're with, I guarantee they're going to have a new plan and they're going to hope you don't switch your, because they're going to decrease your benefits and charge you more, for MRIs and doctors and hospitals and stuff like that, stuff you don't notice. And they'll upgrade the plan to get new people to join possibly. So you want to switch to a new upgraded, the new model. So let's see. I am 75 now. First wife passed when I was 24. Can I draw on this? Yeah, if you are married to that person for 10 years, or you were married when that person passed, and they're insured, and if you're not married now, or you're married, remarried after 60, absolutely, absolutely, call up Social Security and say, hey, I want to file for surviving spouse benefits, and yeah, I mean, it doesn't hurt to try. All they can say is, yeah, sorry, no more money there. So. Um, what an awesome community we have here. I'm sorry, Bruce T. I hope it is a slow progression. What an awesome community we have here. Looking out for each other, sympathetic to each other. That's awesome. Can you work while you're on SSDI? And if you can, is there a limit? Yes, I just did a longer video on this, but super long story short, the first 9 months, not necessarily consecutive, you can make $1 billion a month. And it's called the trial work period. So, and if you continue to make $1 billion a month for 9 months, then they switch to the extended period of eligibility, where they stop your check any month you go over $1,550. But watch my longer video I did on SSDI and working. I also did about a week later one on SSI and working. So make sure you watch the one on on Social Security disability and working. So, because there's two different types of regulations there. Who should we talk to about the best Advantage plan to go with? Yeah. Email me and give me your name, state, phone number, and just say, hey, put me on your list for October. And I'll put you on the list for October. When the new plans come out in October 1st, we'll schedule a time. I'll have a member on my team make sure you put your state, because they're all state specific. And then they'll go over your plan and all the new plans available for 2025. And they'll compare apples and apples and give your options, and you decide. So if you like your current plan, they'll say, all right, you're good. Don't do anything. No. President Nixon should have never implemented SSI. Well, Nixon really didn't. Yeah, the SSI was supplemental security income. It's the welfare-based program that Social Security administers. And it was already being done. It was just being done in kind of haphazardly by all the states. And what happened in the early 70s is the government decided, well, we need to kind of make this a little bit more, I don't want to say logical, but consistent. So Social Security took it over. How about this food allowance that people are talking about for Social Security Medicare recipients? Okay, all right. Yes, there is. They do exist. Those grocery cards and utility assistance and the flex cards, all of those do exist. Whether it exists in your particular area, that's a whole different thing. And usually the ones with the most benefits, the most of those, the grocery cards and the flex cards and with dental and all, the programs with the most are for people with Medicare and Medicaid, called dual eligible. Those are the ones that have the richest benefits generally across the board. But regular ones have those as well. And those are the ones that are, probably going to be really cut back in October from what we think. But yeah, they do exist. But the problem is that there's been too much hype about it, kind of bad advertising. You get a lot of insurance, companies, and they advertise, oh yeah, there's this, grocery card for, has $10,000 on it every month. And, that might be, one place in Paris. I went to high school in Paris, Texas. So I always use Paris, Texas. It's only good in Paris, Texas. There's this one that's super good in Paris, Texas, and there's nowhere else in the country that has it. But what insurance companies have been doing is they advertise it to the whole country on Facebook and every place. And so the people from all over the country say, hey, I want that $10,000. And I say, yeah, sorry, you don't live in Paris, Texas. And therefore, yeah, then they do the high pressure sales on you and, sell your information. And could you tell them, oh, okay, well, if I don't get to $10,000, I don't want it. Then they've got your name and your phone number and your address and probably all that kind of good stuff. And then they sell your information and then people harass you forever. So that's also going to stop. So the government has finally come down and says, no, you can't do that kind of bait and switch thing. And no, you can't, sell that information like that without that person's authorization. So those are two good things. The government actually doing good things down there sometimes. Is that awesome or what? Let's see. What if one has more than, okay. Oh, state retirement ER. Oh, okay. The TRS, teacher retirement system. Yeah. So if you have the TRS, the Texas retirement system, then you are what's called the windfall elimination provision. So your benefits that are on SSA.gov is incorrect because you're getting a non-covered pension. I've done like 3 or 4 videos on windfall elimination provision and all that. So make sure you check those out. Can a person that has active cancer treatments get a Medicare Advantage after the SSI, after the SSDI 2 years Medicare wait? Yes, a Medicare Advantage. There is, yeah. This whole thing is crazy. Medicare Advantage, no preconditions, no issues whatsoever. Medicare Part A, no issues whatsoever with any how sick you are, preconditions, anything like that. Obamacare, no issues, preconditions, doesn't matter how sick you are, you can get. So it's strange. Yeah, you can, doesn't matter how sick you are, you can get Obamacare. It doesn't matter how sick you are, you can get Part A, Part B. Doesn't matter how sick you are, you can get a Medicare Advantage. Doesn't matter how sick you are, you can get a prescription drug plan. Medicare supplements, the Plan Gs and the Plan Ns, the Medigap, those are the ones that, yeah, if you're sick or, just you have certain conditions, there's health underwriting. But there's not health underwriting if you do it at 65. Around when you turn 65, they can't discriminate against you if you have any type of disability. They can't charge you extra because of any disability. They can't even ask you any questions about how healthy you are. Once you're new to Medicare, so if you had health insurance from work at 65 and you say, I'm not going to sign up for Medicare, and you don't sign up for Medicare Part B until 70, as soon as you get Part B at 70 years old, then you can sign up for anything at that time too. And it doesn't matter about any type of disabilities or health or anything like that. So that's one thing I think should be changed is if that's changed, then more people will be able to get Medicare supplements and don't have to deal with networks and all that. But yeah, insurance companies make too much money with Medicare Advantage. They're not going to let that happen for any time in the near future, unless you all make them. You know, how long does it take to finish your case getting your ex's Social Security? If you got the documents, I've done those applications, and it's taken what 6 minutes. But my fingers are faster than usual. But no, if or two to get an appointment, so call up and get your appointment and get your documents, your marriage certificate and divorce decree. If you don't have them, don't worry about it. Set up the appointment first, and then once you get to your phone appointment or in-office appointment, takes about 6 minutes, and then they'll push the button, and your everything is good. Your case will be approved, adjudicated by the time you walk out of the building. I know because I've done several 100,000 of those. You answered my question. Thank you. I'm a former health claims processor, and they don't get away with their canned answers. I make them explain when I ask. Okay. All right. Let's see here. You got a lovely endorsement today from YouTube channel called Buzz's Retirement Garage. Word about you is spreading. Oh yeah, I've watched that guy sometimes. Yeah, yeah, the Buzz Retirement Garage. Yeah, I'm a car guy, so I as soon as I saw garage, I'm like, oh, garage. Okay, I love. Yeah, yes, for sure. His numbers are climbing. Yeah, yeah. That's again. That's it's I guess it's a tad ego boosting, but I don't look at it like that. Number one is again, this algorithm, this YouTube and TikTok and Instagram and all that kind of stuff. We have to teach this nameless, fameless artificial intelligence algorithm that this stuff is important. Sure, cat videos are fun or people falling down or whatever, celebrities making toast, whatever people, those get millions of views, but we need to teach this stupid algorithm that this is what really people, are dependent on. There's people out there suffering. So that's why, I hate to say it all the time, subscribe, like, share, because that's the only way it's going to get out to more people. And I guarantee there's, thousands, tens of thousands, hundreds of thousands of people out there that, need the help. And every time y'all push that button, then it helps someone else. The extra benefits I get in Maine are 3 times higher in North Carolina for the same plan. Yeah, yeah, and you have had cases where people said, yeah, how come the guy across the street can get $2,000 of dental, but I only got 1,000? Well, unfortunately, across the street is a different zip code or whatever, and those plans are actually different across the street than they are. So that's another reason people, when they move, they move to even the same city, they move to the other side of town or wherever, and they don't realize they have to switch their Medicare Advantage plan sometimes. So or they definitely should check, because even in the same city, same town, yeah, the Medicare Advantage plans are different based on geographic areas. All right, I am at over an hour. Let's do a couple of more. Let's try to find someone that I don't recognize that had never been here before. Pam called Social Security in February when X died. Social Security said name was too common. Death certificate was wrong. To coming July means slow mistakes. Refused back pay to March. Can I do anything? Losing a few thousand back pay. Yeah, so it's a very, very common name. They couldn't find the Social Security number, and the death certificate was wrong. So yeah, that's why they asked for the Social Security number when on the death certificate they put it on there, because they automatically notify Social Security and the Treasury about the passing. So no, yeah, if you're entitled to benefits back until March, so once you get your letter, the decision letter that says, hey, here's how much your benefit is and here's when it's going to start, it'll have on there, if you disagree, fill out this SSA 561 or download it. And then, yeah. So if you called Social Security February when X died, so if you were at least 60 at that time, then you're entitled to benefits going back to February. Your February check will come in March, but yeah, you're entitled to benefits starting February. So I would file that appeal, the 561, and say, I disagree with the month of entitlement. It should be February, and then someone else will look at it. And yep. Cynthia, hello. I got a call today from a number with Heartland. I was in transit and could not talk. They will call tomorrow. The man said you asked him to call. Just checking. Yep, yep. That's those are my guys. Heartland. Yep. Let's see. So I'm sorry. I'm going to be skipping around. I'm going to try to find someone. Kathleen. I'm sorry. I just got on the chat. You may have answered this already. It's retirement age going up to 70 and how could it affect benefits. That is a proposal out there, but nothing is official yet. So I've done several videos on that. Now, the people that want to switch it to 70 have, easy office jobs. My father was a long distance truck driver. My mother worked at a, breakfast diner. Yeah, that's jobs you can't really do till you're 70. So yeah. So there's other ways to fix it. Let me see. Who else don't I recognize? Diana, I don't think has asked a question. As am ex-spouse, divorced 2 years and 6 years older. I'm full retirement age from SSDI, converted Social Security at your FRA. Okay. X will be 62, 2025. Will I get less filing on his benefits at 62 instead of 65? Yes. So, so he will be 62 in 2025. So remember, he doesn't have to have filed by that time. As long as he's 62, you can do what's called that independently entitled divorce spouse benefits. And yes, you will get less benefits anytime you take your benefits early from Social Security, retirement, spouse, surviving spouse benefits. You take your benefits early, it's going to be reduced. So, but I would check out your options. So at that time, I would call and set up an appointment and file and say, hey, how much this year if I start my money this month? And then say, okay, what if I start at this time next year? And they'll give you the different numbers and you can play it around and figure out when you want to start your benefits. Uh, Let me see. Darlene, hi. Pray all is well. Yes. Every day above ground is a good day. Thank you for the info. I have battled with Social Security since 62. I'm now 66. They even tried to say your info was wrong. Wasn't accepting, but I had my phone call today at 6:26. Oh, wonder what they're saying. I'd be interested. Wonder what they're saying was incorrect. So, all right, let's see. Accidentally heard you talking and called back. They found it easy. Yeah, all right, good deal. So that they found that Social Security number. Yeah, it's pretty easy to find. All right, last one. My FRA is 67, full retirement age. Is it mandatory that I take it at 67 or could I wait until 70? I'm currently disabled on SSDI or automatic. So if you're on SSDI, no, you don't have to do anything. Your benefits, yeah. Well, you do have that option. Okay, so this is a little complicated. So you're on disability. So you've been, however long you've been on disability, you've been receiving your full retirement age benefit. So once you hit your full retirement age, Social Security will just switch you from disability to retirement benefits. Your check will stay the same. However, you do have the option once you hit your full retirement age to call up and say, suspend my benefits, stop sending me a check. I want my benefits to increase 8% every year until I reach 70. It's called voluntary delayed retirement credits. And this is one of those ones, if you call in, they're going to say, yeah, there's no such animal. And, come back here and I'll provide the reference number for you. But it's called voluntary delayed retirement credits. So once you hit your full retirement age, if you want, you can stop your benefits and then your benefits will accumulate that extra percentage, 8% per year. So for 3 years, that's 24%. So if you're receiving $1,000 at your full retirement age, you stop it and then you start your benefits at 70, you're going to receive $1,240 for the rest of your life, plus all the COLA increases. So that is an option. So a lot of people don't know about that. A lot of people don't do it because they need the money, and I think a lot of people don't do it because they don't know about it as well. Even Social Security employees, unfortunately, don't know about it. So because it doesn't happen there often. All right, that'll do it for today. I appreciate it. If I didn't get to your question, make sure you join me again tomorrow. I think tomorrow's number 74 of my continuing. So I'll be back here tomorrow.